Many thanks for staying with us. We now bring you health-related stories. In Niger State, healthcare delivery faces a crisis, as revealed by the Niger State Chairman of the Nigerian Medical Association, Dr. Yusuf Mohammed. Dr. Mohammed disclosed that due to a mass exodus of healthcare practitioners, one doctor now treats about 40,000 patients in the state. This situation has been exacerbated by the migration of healthcare workers to other states and outside the country. In 2023 alone, over 1,417 resident doctors moved to the United Kingdom and the United States of America. The Medical and Dental Consultants Association of Nigeria also stated that 9 out of every 10 medical and dental consultants were leaving the country. Dr. Mohammed further noted that the current number of doctors in the state, less than 40,000, is insufficient to meet the needs of the growing population. So at this time, joining me on the news to discuss this is the Chairman, Nigerian Medical Association, Niger State Branch, Dr. Yusuf Mohammed. Thank you so much, Dr. Mohammed, for joining us.
Thank you very much for having me.
So let's start this way. First, can you elaborate on the specific challenges faced by doctors in the state due to the poor doctor-to-patient ratio?
Well, thank you very much. When we look at it, the issue of medical brain drain is a global pandemic. It's not only specific to Niger State alone, but it's something that we face worldwide. And the problem is that many health workers, not only doctors alone, leave the service of the state and the federal government to another place where they think, they will get better pay, better remuneration, better service conditions, and so on. But in our own case, this has caused a lot of problem to us, the little health workers that remain in the state. This resulted into what we call burnout syndrome. The more the doctors or health workers leave the service of the state, the little ones that are around, they will leave a lot of work for them to do. We will not say because we don't have enough doctors, therefore let's close down the hospitals and so on and so forth. The hospital is always open 24/7, and people access care all the time. And this will now make it that those few that remain will have more work to do. As it has been stated by the Bureau of Statistics, that we have 1 to 40,000, one doctor to 40,000 per patient in the community, which is very, very high and is far, far above the WHO recommended, what the WHO recommended, that 1 to 600, 1 doctor to 600 patients. So we can see that there's a lot of problem, and this will make the little one actually to experience what we call burnout. They will get tired easily, they will get fatigued, and this will not make them to give the best that they're supposed to offer in rendering healthcare service to the people. Thank you.
So yes, the talk has always been around the stress these medical practitioners go through when it comes to doing their bits, and also the issue around finances, or should I call it poor remuneration and poor working conditions. Is it that there are no bodies that engage in talks at the top echelon of this medical field that discuss about what needs to be done? Or why is it that we still have issues of these doctors wanting to leave? And we've had, over the years now, we've had cases of incessant strikes, industrial actions, with these personnel asking for increased or better pays in terms of the stress that they go through and the services they have to deliver. So is it that nothing is being done to ameliorate their plights?
Well, let me say nothing is being done, but I think to some extent, some things have been done. It's not that we keep quiet, and people have been talking to government to make sure that they intervene in this situation. Because if we did not intervene now, we don't know what is going to happen to healthcare delivery in the near future. And as you said, sir, that majority of these things centered on remuneration, good working condition. And believe me, if we have all these things in place, honestly speaking, nobody will go and say he's looking for another greener pasture where you are already in a greener pasture. So if all these things is being addressed, the issue of poor pay is being addressed, that's the remuneration, and also the working condition, the environment, and the issue of security. If all this has been addressed, I tell you, our healthcare workers are ever ready to render their service in their fatherland. And government are actually, we have been talking to government, and other people also have been talking to government to make sure that things are done the way it's supposed to be done. And this will also help us if other civil society organizations also, as they have been helping us, to echo it to the public and to the government so that they will be able to rise to their responsibility and make sure that things are done the way it's supposed to be. The issue and importance of remuneration cannot be overemphasized to every civil servant in this country. So health workers are not exception. So we need to see how we do what's supposed to be done, as we are crying to government every day to improve on the remuneration, welfare of doctors and other health workers, and also to improve in our working environment and to make sure that we have good security in our workplaces. Thank you, sir.
All right, Dr. Yusuf Mohammed, it was nice talking to you. Thank you.
Thank you very much.